Let's chat about some other non-surgical options. So other than filler, and we mentioned creams, what else can be, and I guess IPL, all great modalities that you already talked about. Any other types of treatments that people consider? I mean, certain topics, I guess, that, or certain categories we haven't really touched on would be like thread lifting, something that is becoming more popular. So do you see any role for that? And I guess some of the more heavy duty lasers, or if there's something else out there that you use?
Sure. So thread lifting, I don't think does well under the eye. It can do well by the canthus if you want a more almond-shaped eye or like a temporal lift, so like we're talking about above the eye at that point. I mean, those are obviously temporary. I don't think they last really as long as filler does, and I mean, at least I haven't seen that. And you need tissue to hide it in. So again, like I was saying, the thinness of the tissue under the eye just really doesn't lend itself to that. As far as lasers, I would group maybe into ablative and non-ablative lasers.
Okay.
And actually, there's probably another energy modality which you can use also radio frequency under the eye. With ablative lasers like CO2 lasers, erbium, so on. I mean, I think that you can definitely get a good effect. I have certainly done it where I've had like an upper lid bleph and then like a lower lid laser, and people who just have like a lot of dramatic lasis, like wrinkled skin, like laxity, as opposed to bags of fat under their eyes. And I've had people who have sort of like minimal to moderate amounts of that. And we do like a non-ablative laser, which then you can just do in the office, and it's very fast. And the differences for the patient mostly being, it's all on one spectrum of like effect and downtime. So the stronger, the ablative ones, more downtime, redness week, 2 weeks. And then the non-ablative ones are done in the office. I mean, you can have the ablative one in the office as well too, obviously, but that's like 2 days downtime. So great for like a weekend. Friday you do it, Monday you're going to work, and there's no downtime from it that takes that long. So
what about a plasma pen? That's something that you see a lot online, and I don't really know anyone using it regularly, but you see all those little like darker marks, especially like they try to replicate like an upper bleph with it. Have you seen any efficacy with that?
I think like on the spot you can see something, but I don't know that it lasts very long. I've seen more with like those plasma pens are like the helium fueled ones along the perioral space for like deep smokers lines. It does like a deeper resurfacing, almost like a dermabrasion. But those spot treatments that you're talking about, where they have like the map out a space and try to shape the tightening of the upper lid that they create by the map, I think like 6 months later you're sort of back to where you were. So
that's sort of the feeling I get with that.
Yeah.